Hi, this is Dr. Gentry, and I'm here with one of my patients, Ms. Paula Bruce. This is Mrs. Bruce. Mrs. Bruce, tell us about how your experience was before you did the Solesta. I mean, could you go out to dinner? Was your quality of life affected by your bowel incontinence?
Yes, very much. It was a constant thing, and didn't matter whether it was dinner or anything else. You know, I constantly had to wear a pad, be very mindful of if surprises, and sometimes I had to be very mindful of wearing dark clothing in case there was an accident, even with the pad, because it seemed like the stool did not stay in the rectum long enough to absorb the liquid, so it was always of a soft consistency. So I was taking usually 6 to 9 Imodium a day, plus drinking another firmer. And since then, I have taken no Imodium, and I don't drink any of that. Have not really had any accidents. You know, nothing compared to what it was before, and I would say basically none. So it's completely, I think, changed my life. It's been great.
How long did it take before the Solesta actually affected some of these symptoms that you described?
I would say just a few weeks, and it's, continuously seems like it's getting better. And I will say that, when I first heard about the procedure and needles, I was, like, oh my gosh, they don't put you to sleep, they don't do anything. I was very, very surprised that there's really no pain involved. Maybe the slightest bit of discomfort, but what I've told people, it's no more than going to the dentist and having your jaw numbed and just kind of that pinch, and that's really all it felt.
So would you recommend the Solesta to other patients who have tried things that didn't work, or who weren't candidates for other major surgeries? Would you recommend that?
Definitely. I mean, I don't see that there is any con to it. There's, lots of pros, I just don't know of any con. It's like you'd really have nothing to lose, even if you were like a worst case scenario. And I was feeling like I was kind of worst case scenario because I actually needed the artificial sphincter muscle, but it's not available at this time. And I had the sphincterplasty done several years ago, and that was not holding it. So this has just worked, I guess, along with that, and it's been excellent. Results have been excellent.
Well, great. Well, thank you for your time, and I'd like to thank Mrs. Bruce for offering that patient testimonial.